Infraspinatus muscle, its origin, insertion, and actions. The infraspinatus muscle is a thick triangular muscle occupying most of the scapula's dorsal surface. It is also one of the 4 rotator cuff muscles. We can see that the infraspinatus originates, proximal attachment, from the infraspinous fossa of the scapula. It inserts, distal attachment, at the greater tubercle of the humerus. The innervation of the infraspinatus comes from the suprascapular nerve, C5-C6. The actions of the infraspinatus muscle are shoulder external lateral rotation, assistance in shoulder horizontal abduction. Being one of the rotator cuff muscles, the infraspinatus is an important active stabilizer of the humeral head during shoulder movement. To strengthen the infraspinatus, use its origin, insertion, and actions. The teres minor muscle, shown here in red, is a narrow muscle which lies below the infraspinatus, above the teres major and the triceps brachii, and deep to the deltoid. It is also one of the 4 rotator cuff muscles. As we can see, the teres minor originates, proximal attachment, from the middle part of the lateral border of the scapula. It inserts, distal attachment, into the greater tubercle of the humerus. Its innervation comes from the axillary nerve, root C5-C6, which originates from the posterior cord of the brachial plexus. The actions of the teres minor are shoulder external rotation and assistance in shoulder horizontal abduction. Since it is one of the rotator cuff muscles, the teres minor also helps in the mechanism of force coupling by stabilizing the shoulder joint and pulling the head of the humerus towards the glenoid fossa of the scapula. Spinatus muscle, shown here in red, is a small muscle located in the upper back. It is also one of the 4 rotator cuff muscles. As we can see, the supraspinatus originates, proximal attachment, from the supraspinous fossa of the scapula. It inserts, distal attachment, at the greater tubercle of the humerus. Its innervation comes from the suprascapular nerve, C5-C6. The actions of the supraspinatus are joint stabilization and shoulder abduction. In shoulder abduction, the supraspinatus is mainly responsible for abducting the shoulder from 0 to 15 degrees. Beyond 15 degrees, the deltoid muscle becomes more dominant. Being one of the rotator cuff muscles, the supraspinatus is an important active stabilizer of the joint. It assists in keeping the head of the humerus firmly pressed medially against the glenoid fossa of the scapula. To strengthen the supraspinatus muscle, this muscle, shown here in red, is a large triangular-shaped muscle located in the subscapular fossa, anteriorly to the scapula. It is one of the 4 rotator cuff muscles. As we can see, the subscapularis muscle originates, proximal attachment, from the subscapular fossa of the scapula. It inserts, distal attachment, into the lesser tubercle of the humerus. Its innervation comes from the upper and lower subscapular nerves, C5 through C7. The primary action of the subscapularis muscle is medial rotation, internal rotation of the humerus. Since it is one of the rotator cuff muscles, the subscapularis also helps in the mechanism of force coupling. Pectoralis major is the most superior and largest muscle of the anterior chest wall. It is commonly divided into three independent segments: the clavicular part, the sternal part, and the costal part. We can see that the clavicular head originates, proximal attachment, from the anterior surface of the medial half of the clavicle. The sternal head originates from the anterior surface of the sternum and the first 7 costal cartilages. The costal head originates from the cartilage of the 6th rib and the aponeurosis of the external oblique. The muscle fibers from all three parts run laterally and converge into a broad tendon that inserts distal attachment into the lateral lip of the intertubercular sulcus of the humerus. The innervation of the pectoralis major comes from the lateral pectoral nerves and medial pectoral nerves. Lateral and medial pectoral nerves, C5 to T1. The actions of the pectoralis major are shoulder horizontal adduction, shoulder internal rotation, and shoulder adduction, mainly by the sternocostal head. The clavicular head can create flexion when the shoulder is in an extended position. The sternocostal head can extend the shoulder when it is flexed.
Hi, this is Peter from Anatomy Zone, and in this video we will take a look at the anatomy of the deltoid muscle. The deltoid muscle is the large superficial muscle of the shoulder, which gives its characteristic shape and contour. It's called the deltoid muscle because of its roughly triangular shape, which resembles the Greek capital letter delta. Let's take a look at the origins of the deltoid muscle. Anteriorly, it originates from the superior aspect of the lateral third of the clavicle. Laterally, it originates from the lateral margin and superior part of the acromion process of the scapula. Posteriorly, it originates from the inferior edge of the spine of the scapula. The deltoid muscle is divided into 3 distinct sets of fibers on the basis of these 3 origins that I've just described: the anterior or clavicular fibers, the lateral or acromial fibers, and the posterior or spinal fibers. These different fibers of the deltoid are often referred to in strength training and bodybuilding circles, whereby different exercises are utilized to target the different fibers of the deltoid. In this way, they are referred to as the anterior, lateral, and posterior deltoids, or delts. The fibers of the deltoid muscle converge to form a short tendon, which inserts onto the deltoid tubercle or deltoid tuberosity on the lateral aspect of the humerus. The morphology of the deltoid muscle, with its 3 sets of fibers extending from anterior to posterior around the glenohumeral joint, mean that this muscle can produce several movements depending on whether the fibers contract independently or simultaneously. As you may expect from its origin, the anterior fibers draw the arm forwards to flex the shoulder, and they can also medially rotate the humerus. The posterior fibers do the opposite. They extend the shoulder and cause lateral rotation or external rotation of the humerus. The posterior fibers act synergistically with the trapezius and teres major muscles. The lateral fibers, arising from the acromion, are powerful abductors of the shoulder and are assisted by the supraspinatus of the rotator cuff in this movement. It is innervated by the axillary nerve, which arrives from the posterior cord of the brachial plexus. So that's the anatomy of the deltoid muscle.